Thank you, Mr. Speaker. Colleagues, this is the final amendment to the bill, which will not kill the bill or send it back to committee. If adopted, the bill will immediately proceed to final passage as amended. My amendment provides an important safeguard for the economic security of American families by maintaining the consumer-friendly protections in the Affordable Care Act. For one, the cost-saving provisions in Medicare for lower prescription drugs for our parents and our grandparents. And two, the vital consumer protection that prohibits insurance companies from denying coverage because someone has a pre-existing condition like cancer, asthma, or diabetes. The Affordable Care Act that Republicans say they want to repeal without a replacement bill in sight provided these very important consumer protections for all Americans, not just the 20 million Americans who gained health insurance through the marketplace or healthcare.gov, but the vast majority of Americans who are covered through Medicare. That's about 43 million Americans. And the folks who have health insurance through their job. It's about 155 Americans. Here's what the Affordable Care Act has done for those folks. One, Medicare is stronger. The Affordable Care Act strengthened the Medicare Trust Fund, extending its life over a decade. In addition, Medicare enrollees have benefited from huge savings in prescription drug costs. They've also saved through preventative screenings for breast and colorectal cancer, cardiovascular disease, and diabetes, that when they go to the doctor's office now, there is no cost. There is no charge. That's the Affordable Care Act. So if Republicans aren't careful in their zeal to repeal the Affordable Care Act, they, in essence, will be asking our parents and grandparents to pay more, a whole lot more for their prescription drugs. And let me get a little local here. I represent the state of Florida, where about 18% of Floridians rely on Medicare for their health care. The ACA, because of the Affordable Care Act, it has started to close the donut hole. Repeal it now and that stops. That goes away. Just in 2015 alone, 350,000 Florida seniors saved $351 million on their prescription drugs. That's an average of about $1,000 per beneficiary. So my amendment makes the point that Democrats are going to fight for our older neighbors to keep those savings intact. Brought to you by the Affordable Care Act. Second, we also want to put everyone on notice that Democrats intend to fight tooth and nail to keep the vital consumer protection, one of the bedrocks of the Affordable Care Act, that bars health insurance companies from refusing to cover you or charge you more because you have a pre-existing condition, or charge women more than men. Whether you know it or not, all Americans have benefited from the bar on discrimination from pre-existing conditions since January 1st, 2014. So if you have health insurance through your employer, you've benefited from the Affordable Care Act. You go to healthcare.gov because you're a student or a part-time worker, or you don't have it through your job, you have benefited. You get health insurance for your children through the Children's Health Insurance Program or Medicaid, you're no longer subject to discrimination. Remember a few years ago when insurance companies maintained a long list of conditions, a long list of conditions where they said if you have cancer or diabetes or something, you're automatically excluded. That's the way things worked. A congressional investigation into this practice during the health care reform debate uncovered more than 400 medical diagnoses or conditions that insurance used to justify coverage denial. At the top of the list were cancer, heart disease, pregnancy, diabetes, HIV/AIDS, multiple sclerosis, muscular dystrophy. And you know what? Generally, states with the highest rates of denial were in the South and the Midwest, where the overall health status of residents has consistently been worse than in other parts of the country. The incidence of cancer, heart disease, and diabetes is higher in those states. Well, now you cannot be discriminated against for those pre-existing conditions. That kind of discrimination wasn't right. It had no place in America. So we outlawed it in the Affordable Care Act. just like one of my neighbors, Christine Roper in Tampa. Christine is 26. She recently aged off her father's insurance and was unsure how to find coverage because she has a heart condition and asthma. Before, she would have been prohibited from getting health insurance, but not today. Expired. And we're not going backwards. That's because millions of Americans who can now buy coverage would be forced back into the ranks of the uninsured. We're going to start this Congress off by standing up for our families and rejecting any attempt to replace.
I rise in opposition to the motion to recommit.
Gentlewoman's time is expired.